I have been involved to Scandinavian prostate cancer group, and about 20 years ago we were planning to have adjuvant studies because it was known that in colorectal and breast cancer adjuvant chemotherapy is beneficial. And then we started 2 studies, 12 and 13, and I was the PI of the 13, where we included high risk or intermediate risk prostate cancer who received local radical radiotherapy, and also LHRH analogs for 9 months. And after radiotherapy, they were randomized either to surveillance or 6 cycles of docetaxel normal dose. The primary endpoint was biochemical recurrence-free survival, and it is presented at 5 years ago in GUASCO, and there was no gain of docetaxel. 30% of the patients had PSA recurrence. And the secondary aims were quality of life and overall survival. And the quality of life results, which is also published, showed that at the time of docetaxel, the quality of life of patients were statistically worse than those in follow-ups, but after 1 year, they were at the same level. And now I'm going to present the 10-year or over 10-year survival results. And the median survival of the surveillance group was long, 14.5 years. And it's not yet reached in the docetaxel group. However, there was not statistically significant gain from docetaxel. And patients with high Gleason group, 8 or more, tended to have better prognosis, better survival when they received docetaxel, but the group was so small that it was not statistically significant. So the main conclusion is that there is no benefit to the patient to give 6 cycles of docetaxel, and we need pattern markers prognostic marker to select patients for this type of trials of treatments. Clinical significance is that it was the first long-term follow-up in this kind of adjuvant trial. And of course, before that, it was discussed with the patients about the harms and benefits of docetaxel in some cases, but now I think it's over.